Just some things to talk about with aligner success. Talk about, how do you make your aligners more successful, and what are things that you need to keep in mind? And these are just some things that a lot of general dentists kind of miss. So, of course, case selection is a huge deal. You need to pick a good case for aligners. And there's a lot of case parameters, and it's really difficult for me just to kind of sum it up in a box. It really takes a lot of just looking in cases to let you know if this is a good case for aligners. Number two, of course, once you've picked a good case, you got to have a great design. And if you were on our webinar earlier today, and there's probably some links for that if you want to get him, but basically we talked to Dr. Rishi, who's an orthodontist, and he told us on average his Invisalign treatment plans take 5 to 10 go rounds to get right. That's 5 to 10. And there's usually a 24-hour turnaround. So, it's taking him almost 2 weeks to approve a treatment plan. Mine, maybe 3 to 6 goes, to get it right. It depends. You shouldn't be approving a treatment plan on the first go because it's not optimized. It's just like it's a shot in the dark. Sometimes it's great, but the most part, it's a technician in a different country that's just playing a video game. That's basically what it is. And they're playing a video game with your patient's mouth. And just because the simulation says it's possible does not mean it's necessarily possible for that patient's mouth, for that patient's facial structure, for that patient's profile, for that patient's bone density, for that patient's periodontal status. I can keep going, for the vitality of that patient's teeth. It's not always right. It's not always the right thing to do. So you really need to, before you jumping into aligners or Invisalign or ClearCorrect or anything, or any type of braces, you need to be educated. And that's what we recommend, that you have someone to connect with if you have questions. So production, that's a big issue too. You should know who's producing, where the lab is. Of course, your Invisalign, ClearCorrect are great facilities for production. If you're using an off-label, you should know a little bit about what thermoplastic material are they using? What are the stain qualities? What are the qualities with wear? Is it ISO certified? Is it made in the USA? It's all things. I want the MSDS sheets. Tell me a little bit about how often I need to change it. You should know, obviously I'm really familiar with the top ones. You got your S6, S6 Ace, Zendura, Zendura Flex, Invisacryl. But there's more, that people use out there, and I'm not that familiar with them. So if you're using a one-off one, you should try to get some information about it. Lastly, a tip for success for Invisalign or ClearCorrect or aligners in general is going to be compliance. You need to develop not only a compliance contract, but a compliance program for success. And you can't just throw a bunch of aligners at your patient and be like, okay, cool, see you in 4 weeks. That's not going to work. They're not going to wear them right. They're not going to know what to do. You need to have a check-in protocol. You need to it's not always 2 weeks or 1 week is a magical amount of time. Sometimes it's less, sometimes it's more. And you need to understand how aligners work yourself and your team so you can educate your patient and have a full, compliance program. And that's something that we'd be glad to help you with if you have questions.